Have you been told you have fatty liver disease? Are you unsure of what that means? Well, stick around and I'll answer all your questions about what fatty liver disease is and what it means for your health. If you learned something, please like, share, and subscribe. You may have been told you have fatty liver disease based on imaging or lab work, but what is fatty liver disease? Fatty liver disease is when an increased amount of fat is deposited in the liver. Now, in the medical field, you may hear several terms to describe fatty liver disease. These include NAFLD or NASH. To confuse things further, but to better define the disease, the AASLD has come up with new terminology. Fatty liver disease is now called steatotic liver disease, or SLD, and is a general umbrella term for the different types of fatty liver disease. NAFLD, or non-alcoholic fatty liver disease, is when there is fat in the liver with at least one factor for cardiovascular disease. These risk factors include being overweight, having an elevated fasting glucose, an elevated blood pressure, or abnormal triglycerides or bad cholesterol. NAFLD is when there is fat in the liver with very minimal inflammation. NAFLD is now called metabolic dysfunction associated steatotic liver disease, or MASLD. NASH, or non-alcoholic steatohepatitis, is fat in the liver with significant inflammation and is now called metabolic dysfunction associated steatohepatitis, or MASH. I know this is completely confusing, so I'm going to use the old terms just because you're more likely to hear these. Basically, fat in the liver with minimal inflammation is NAFLD, and fat in the liver with significant inflammation is NASH. Now, why do we care about fatty liver disease? Well, here are the 4 keys to understanding fatty liver disease and why it is so important for your health. Number 1, heart attack and stroke are the most common cause of death with fatty liver disease. Fatty liver disease is when fat is deposited in the liver. We tend to think that fatty liver disease only affects the liver, but in fact, fatty liver disease is a sign of overall cardiovascular health. In recent studies, those that had fatty liver disease had an increased risk of cardiovascular-related death, like heart attack or stroke, and death from any cause by up to 6 times. This is the reason healthcare providers recommend regular cardiovascular exercise for those diagnosed with fatty liver disease. Remember, exercise may help you lose a few pounds, but in fact, changing diet has a greater effect on weight than exercise. On the other hand, cardiovascular exercise improves the function of the heart, not to mention the beneficial effects exercise has on our lungs and mental health. Keep in mind, even if you do a job that requires a lot of lifting or physical work, this typically does not count as cardiovascular exercise. These jobs tend to have a lot of stop and go activity. In cardiovascular exercise, our goal is to sustain an elevated heart rate for at least 30 minutes, which helps improve the strength and function of the heart. Number 2, fatty liver disease can lead to liver cirrhosis. Cirrhosis is a permanent, diffuse scarring of the liver that leads to the liver not working well. Globally, viral hepatitis and alcoholic liver disease are still the most common causes for cirrhosis and need for liver transplantation. However, the need for liver transplants due to fatty liver disease has been increasing rapidly. Within the next decade, fatty liver disease will become the number 1 cause for liver transplantation. For those that have NAFLD or fat in the liver with minimal inflammation, the risk of developing cirrhosis is about 1 to 3%. While someone with NASH or fat in the liver with inflammation, the risk of developing cirrhosis is 11 to 13%. More importantly, those with NASH develop cirrhosis at twice the speed as those with NAFLD. NAFLD can worsen to NASH, so it's important to make changes in your lifestyle to prevent progression of fatty liver disease. Despite the different risks of cirrhosis, cardiovascular disease still is elevated in both conditions. As a result of the significant consequences of this disease, it is important to identify it early. So how do we treat fatty liver disease? Well, that brings me to point number 3. Number 3, losing at least 10% of body weight improves liver inflammation and can even reverse scarring of the liver. Cardiovascular disease and liver scarring are some of the gravest consequences with fatty liver disease. Several studies have shown that losing at least 7% of body weight resulted in 90% of those with NASH having complete improvement of NASH. In addition, 45% had improvement in the level of scarring of the liver. Further studies show that the degree of weight loss directly correlates with the improvement of fat and inflammation in the liver. Because there's such a great response to weight loss, we recommend losing 10% body weight to achieve the greatest improvement in the liver. Though NAFLD and NASH respond well to weight loss, remember that scarring in the liver does not respond as robustly. Depending on the severity of the scarring, weight loss can lead to some improvement in scarring, but the improvement is not as direct as with NASH and NAFLD. On the other hand, cirrhosis cannot be reversed with weight loss, but to prevent further worsening of cirrhosis, weight loss is key. In addition to weight loss, what other tools can help in fatty liver disease? Number 4, medications and surgery can help with treatment of fatty liver disease. Weight loss is the key to treating fatty liver disease. In addition to diet changes and cardiovascular exercise, there are tools like bariatric surgery and medications that have been shown to help. For individuals who have tried eating healthy and exercising, but are still having trouble losing weight, it's important to consider bariatric surgery. In fact, studies have shown that there's a 3 to 4 times greater chance of NASH resolving with bariatric surgery than only making lifestyle modifications like diet and exercise. Now, surgery is not for everyone, and the risks with bariatric surgery need to be discussed. Remember, bariatric surgery is a tool for weight loss, but we still need to eat healthy, control portion sizes, and exercise for bariatric surgery to work. For those not interested in bariatric surgery, there are supplements and medications available. For those with NASH without diabetes, daily vitamin E has been shown to improve liver enzyme levels and inflammation in the liver. Vitamin E has not been shown to improve scarring of the liver. In addition, some studies have shown a possible association with prostate cancer and an increased risk of bleeding. Now, these associations are not strong and need to be further investigated. A diabetic medication called pioglitazone or Actos has been shown to help those with diabetes and NASH. I personally do not recommend it because it has been associated with bladder cancer and it can cause weight gain, which kind of defeats the efforts of losing weight. Recently, medications like Ozempic, Mounjaro, Wegovy, and Zepbound have created quite the buzz in the world of weight loss. These are medications that are in a class called GLP-1 agonists. They help induce the feeling of fullness and decrease appetite. A study published in the New England Journal of Medicine compared different doses of semaglutide or Ozempic to placebo and how well it helped with NASH and scarring of the liver. The highest dose of 0.4 milligrams per week resulted in 59% curing their NASH compared to only 17% in the placebo group. However, when it came to decreasing fibrosis or scarring, there was not a significant difference between the groups, even though the semaglutide group achieved a 13% loss in body weight and the placebo group only had a 1% loss in body weight. Further studies are being done to see how to utilize these drugs to help treat NASH, and I think we'll be seeing some exciting revelations in the near future. Well, that was a brief review of fatty liver disease. If you want to dive deeper, I included links to several articles in the description to help you learn more. If you want to learn more about the new weight loss medications like Ozempic, click the link here to see our video. If you learned something, please give a like, share, and subscribe. I'm Dr. K from iMedicalSchool, and remember to keep on learning.